Dr. Courtney, maybe you can join us now and, tell us about your outlook on this and, what the debate is within the medical community here, in terms of whether this is something that is safe for children or not, whether it's something that's effective for children or not.
Well, I was quite a skeptic 5 or 6 years ago. I refused to approve of it for a fellow physician. Currently, my youngest patient is 8 months old, had a very massive, centrally located, inoperable brain tumor. And it's the father's strength to push ahead and get approval from someone and to begin treatment. And the father was successfully able to avoid chemotherapy, radiation, and surgery. And within a couple of months, had reduced the tumor by 1%. In 4 months, had reduced it essentially to zero. And this child, because of that, is not going to have the long-term side effects that would come from very high-dose chemotherapy or radiation.
By the way, I want to pull up to an image that you sent along to us to show our viewers of the difference of the brain tumor and what it was that happened there after a couple weeks. Can you explain that for us in more detail?
Yes, that large white center area is the tumor, and they were putting cannabinoid oils on the baby's pacifier twice a day, increasing the dose, and it was a 3.8% CBD, so it was a high CBD tincture or oil. And within 2 months, there was a dramatic reduction, enough that the pediatric oncologist allowed them to go ahead with not pursuing traditional therapy. And within 4 months, you can see that the tumor is essentially gone. And then by 8 months, the normal architecture had resumed. And at this point, the risk of the MRI is so high that they really don't want to do any more MRIs because of the risk of the analysis. So currently, the child's being called a miracle baby. And I would have to agree that this is the type of response that we should be insisting is frontline therapy for all children before they launch off on medications that have horrific long-term side effects.
Do you feel that there are some ethical questions, to be raised here, though? And, we spoke about it for a moment, that you're not giving, these children marijuana to smoke. It can be administered in other ways, via using cannabis oil. But what about the possibility of maybe, psychoactive effects? How does that perhaps affect a child, affect their development?
There's a lot of information out there that has been built up with the intent of causing confusion. It's quite clear that many of the uses, and particularly the optimal, which is, I'm very interested in raw cannabis, which is non-psychoactive, that the lack of psychoactivity allows those to be very quickly raised to maybe 600 to 1,000 milligrams a day, depending on the individual size, whereas a psychoactive dose is restricted to about 10 milligrams. So the non-psychoactive use of the plant really facilitates a lot of its benefits because it allows elevated dosing.
Jason, I'd love to bring